Hi, I'm Alison Parsons, the Naturopathic Doctor here on campus. Sorry I couldn't be there in person today, but I thought video was the next best thing. So essentially I am here throughout the school year to help patients with any health concerns they may have, whether it be mental, emotional, or physical concerns. My services are completely covered by the university, so coming to see me is totally free of charge. So take advantage of the service, and if you would like to book an appointment, just contact Ilana at the Wellness Center. You can reach her by phone at 705-330-4008, extension 2115. So if you want to book in at any time, just contact Ilana, and I look forward to seeing you. Naturopathic medicine is a primary healthcare system that promotes wellness and prevention of illness or disease. It uses current science-based diagnostic technologies, including blood testing and physical exams, and it also draws on a range of natural therapeutic systems. It plays a very important role in integrative healthcare, so it can be used on its own or in combination with conventional Western medicine. And naturopathic treatments are generally chosen based on the individual patient. So, for example, if two patients came into my office with anxiety, I wouldn't necessarily use the same treatments for those two patients. So as a naturopath, I really aim to look at the root cause of illness or disease. And so I would be looking at those patients and wondering what that underlying cause of the anxiety is, whether it's stress or nutritional deficiencies or adrenal fatigue. And based on the cause, I would develop a treatment plan for that individual patient. There are 6 principles that really nicely sum up the theory behind naturopathic medicine. So I'm just going to touch on each of those. So the first one is to do no harm. So as a naturopath, we aim to use treatments and modalities that really minimize the risk of harmful side effects. The second one is to treat the cause of disease. So we really want to look at any underlying factors of disease and treat those rather than with conventional medicine. A lot of times the treatment is geared at suppressing the symptoms of disease and treating the symptoms. So we really want to look at the underlying cause. The third principle is to teach the principles of healthy living and preventative medicine. So we really want to encourage individual responsibility for health by doctoring as teacher. The fourth principle is to heal the whole person through individualized treatments. So I kind of touched on this earlier with the anxiety case, but we really do want to individualize our treatment plan to each patient that we have in our office. The fifth principle is to emphasize prevention. So as well as treating any health concerns that arise when the patient comes in, we really want to look at their family history, their lifestyle, and really focus on preventing any future illness that may occur. And the sixth is to support the healing power of the body. So our bodies are equipped to heal themselves. They have an inherent self-healing ability. And we really want to hone in on this and make sure that we're supporting the body in what it needs to do. Naturopathic treatments are always individualized to the patient, as we touched on earlier. So there are a number of different treatment modalities that we use for patients and that we can pull from depending on what we feel like the patient needs. So these include acupuncture or Asian medicine. So this is acupuncture is a big part of Asian medicine, and essentially it's the use of thin, small, sterile needles that would be inserted on different points on a patient's body depending on their health concern. It really helps a lot with anxiety, with sleep concerns, hormonal concerns in females. You can use it for almost anything, but those are the things that it really benefits from. So an example of an acupuncture needle is one here. So as you can see, it's quite tiny. So a lot of times when I say that I'm going to needle patients, they get a little bit afraid, but it is quite tiny. It doesn't hurt at all, and it's actually quite relaxing. Another modality we pull from is botanical medicine, and so this is the use of plant-based medicine. So it takes many different plants and extracts a medicinal ingredient, and you can use it in capsule, tablet, or in tincture form. So a tincture would be an example there. It would come in a glass bottle, and it's an alcohol extract of the medicinal quality of the plant. And they tend to be a lot stronger sometimes than the capsule form, so I do like to use those a lot. We use physical medicine, so it could be hydrotherapy or manipulation. We also use clinical nutrition. This is a big thing that naturopaths use, so we look at a patient's diet and see how we can tailor a diet to them that would really benefit them. So we're not just looking at diet as in the Canada Food Guide. We really want to individualize it to the patient and see what they exactly need to optimize their health. We use homeopathic medicine as well. This is more of an energetic type of medicine that works really well for emotional concerns or acute physical illnesses. And then also we use lifestyle counseling. So we sit down with a patient and we look at their lifestyle and see if there's anything we can do to promote health, or if there's any habits, non-health promoting habits they have that we can change up. So a treatment plan will really depend on the individual patient. So we want to, I'll pull from any of those treatment modalities depending on what's going on in front of me, and also depending on what the patient is able to do. A lot of times I will come up with a treatment plan that I think is best, but the patient isn't necessarily able to follow through with that. So a lot of our visits are sitting there and discussing a treatment plan as to what I think is best and what they are actually able to do, and compromising somewhere in the middle. My patients tend to come in with a variety of health concerns. Essentially they range anywhere from common childhood illnesses to female hormonal issues to sleep issues. Essentially anything you would go see your medical doctor for, you could see a naturopathic doctor for. That said, some naturopaths do tend to specialize in certain areas of care, such as pediatrics or geriatrics, sports medicine, cancer care. So it may be in your best interest to search out a naturopath that would suit your needs the best. At the university, some of the most common conditions I treat include acne and other skin conditions, insomnia, stress, depression, anxiety, really a variety of health concerns. Another common one is digestive concerns, so IBS or inflammatory bowel concerns. If you're ever unsure if you would benefit from seeing a naturopath, just don't hesitate to stop by the Wellness Center, and you can chat with Alana or myself, and we can lead you in the right direction, whether it's that you need to book in with myself or the 2 counselors that we have on site, or if we need to refer you in another direction, then we can do that as well. Some of the major milestones behind naturopathic medicine include the following. The first dates back around 2,400 years to a Greek physician named Hippocrates, who was behind the concept of the healing power of nature. Then in North America, naturopathic medicine traces back to Dr. Benedict Lust, who coined the term naturopathy, which described a natural healing practice that included acupuncture, botanical medicine, physical therapy, etc. By 1920, naturopathic medicine was well recognized in Canada, and by 1925 there were laws in Ontario regulating its use. After the Second World War, the trust of healthcare was put more into the hands of surgical care and modern Western medicine. So the growth of antibiotics and the pharmaceutical industry was huge at this time, and that carried well into the 1950s. And it wasn't really until the last 20 years that naturopathic medicine has started to make its resurgence. I think people are really realizing that they don't always like the surgical trend of medicine and the overuse of antibiotics, and so they're really gearing back towards a more natural approach, really trying to cope with day-to-day stresses, prevent illness, and live a more natural life. Naturopathic doctors are governed under the RHPA, or the Regulated Health Practitioners Act, so they do need to be licensed in order to practice in Ontario. In order to obtain a license, naturopathic doctors need to undergo a 4-year accredited university program, as well as a 4-year medical program at an accredited naturopathic college. So you can do that in Canada or in the States. From there, the graduates must pass 2 sets of licensing exams and also maintain continuing education every year. And so as long as the naturopaths do that and can keep up their license, then they're legally registered to practice in Ontario. I think one of the biggest issues around naturopathic medicine is public misinformation. A lot of people don't know of the services that we can offer or the extensive training that we have, and so I find that as a whole, naturopathic medicine is undervalued and underused. Our society really is in need of much more preventive healthcare. Our healthcare system is overburdened right now, and we would definitely benefit from more naturopathic care and just more preventative healthcare in general. A second criticism would be that some people find naturopathic medicine hard to afford, as we aren't covered by OHIP as medical doctors are. That said, we are covered by most extended healthcare benefit plans, so if people do have those, it makes it quite affordable, but for those of us who don't, it can be a hindrance in order to obtain our care. That said, it's pretty amazing that the university supplies this service for the students, so really be sure to take advantage of that while you're here and come into the Wellness Center and book your visit. But that pretty much sums it up. So thanks for listening. I hope you learned a little bit more about naturopathic medicine. And if you have any future questions, feel free to stop by on a Tuesday when I'm in the office, and I would love to chat further. Have a great night.